Imagine this: you're in love. You trust your partner. The room is calm. But the moment intimacy begins, your body betrays you. Pain so sharp it feels like knives. Panic. Shame. Tears. You think something is terribly wrong with you. And worst of all, you're too afraid to tell anyone. This isn't rare. It's real. And it has a name: vaginismus. As a gynecologist, I can tell you, this silent condition is stealing joy, destroying marriages, and crushing the confidence of women worldwide. Yet, most have never even heard the word. This video will break the silence. We'll explain what vaginismus really is, what causes it, how to recognize it, and, most importantly, how it can be healed. Stay with me until the end, because this might change your life or someone you love. And if you believe in spreading awareness about the health issues no one talks about, click subscribe to join our growing family at Lifelong Vitality. In this video, I'll be covering: what exactly is vaginismus? The shocking physical and emotional symptoms. Why it happens, the causes you've never been told. Who is most at risk? Real examples from clinical cases. And how to diagnose, treat, and fully recover from both the physical and emotional trauma. Let's start by understanding what this condition really is. Section 1: What is vaginismus? Vaginismus is a condition in which the muscles of the vagina involuntarily contract or tighten anytime penetration is attempted, whether it's during sexual intercourse, using a tampon, or even a medical exam. This is not under your control. It's like a reflex: your body's defense system goes into alarm mode, thinking it's under attack. These contractions can cause extreme pain, burning, pressure, or complete inability to penetrate. Some women describe it as hitting a wall, burning blades, or a feeling of being torn apart. What makes vaginismus even more damaging is the emotional aftermath: shame, anxiety, fear of intimacy, self-blame, and in many cases, relationship breakdowns. And yet, women often suffer in silence for years without realizing this is a medical condition, not a personal failure. Section 2: What causes vaginismus? Vaginismus is a complex condition, and unlike a typical illness, it's not caused by just one problem. It's a protective reaction, the body's way of saying no when the mind or body perceives a threat, even if the person doesn't consciously realize it. It's often rooted in a combination of psychological, emotional, medical, and relational triggers. Let's break down the most common causes. Number 1. Psychological triggers. These are emotional and mental health factors that tell the brain intimacy might not be safe. Fear of pain. This is one of the most common psychological causes. A woman may have had a painful first sexual experience or heard frightening stories. Even anticipation of pain can cause her muscles to tense involuntarily. Sexual trauma or abuse. Past trauma, even if it occurred years ago, can leave a lasting imprint. The brain remembers the event and activates the body's defense system, tightening the pelvic muscles as a subconscious form of protection. Strict cultural or religious conditioning. Being raised in an environment where sex is seen as shameful, sinful, or taboo can lead to deep-rooted guilt or fear. When intimacy is finally expected, such as after marriage, the mind may resist despite consent. Anxiety or depression. General anxiety, especially about relationships or bodily image, can fuel vaginismus. Women with perfectionism or overthinking tendencies may also experience this. Depression can reduce libido, increase sensitivity to pain, and create avoidance behavior. Guilt or shame around sexuality. Number 2. Medical conditions. Vaginismus can also be triggered or worsened by physical issues that make intimacy painful. Vaginal infections. Conditions like yeast infections or bacterial vaginosis cause pain and burning. If intercourse is attempted during or after an infection, the body may remember the pain and react defensively in the future. Urinary tract infections, UTIs. UTIs can cause burning during urination and tenderness, making intimacy very uncomfortable. This pain may condition the pelvic muscles to contract preemptively. Endometriosis. A condition where uterine tissue grows outside the uterus, often causing severe pelvic pain. The discomfort can make intimacy feel dangerous, causing involuntary tightening. Scarring from childbirth or surgery. Hormonal changes. Especially after menopause, estrogen levels drop. This can lead to vaginal dryness, loss of elasticity, and discomfort, all of which may trigger defensive muscle tightening. Number 3. Relationship or emotional struggles. Sometimes, vaginismus isn't about past trauma or physical problems, it's about current emotional stress in a relationship. Fear of pregnancy. If there's anxiety around getting pregnant, even within marriage, the body may reflexively resist penetration. Trust issues or abuse history. A woman may not feel fully safe or emotionally connected with her partner. Even subtle signs of tension or past betrayal can prevent the body from relaxing. Performance pressure. Pressure to be perfect or fulfill expectations, especially on wedding night, can lead to fear and involuntary resistance. First-time experiences may carry unrealistic expectations or fear of a failure. Lack of communication. If the couple doesn't talk openly about needs, fears, and comfort, it can lead to silence and shame. The body often reflects what the heart is too afraid to say. In many cases, women are not even aware they are experiencing anxiety. The brain simply sends a signal to protect, and the vaginal muscles respond with forceful closure. Section 3 Symptoms of Vaginismus. The symptoms vary in severity, but here's what to watch for. Sharp or burning pain during attempted penetration. Total inability to have intercourse despite arousal. Feeling like the vagina is closed off or blocked. Pain when inserting a tampon. Spasms in the lower pelvic muscles. Fear, dread, or panic before intimacy. Crying or emotional breakdown after failed attempts. Avoiding gynecological exams due to pain. There are two types of vaginismus. Primary, pain has always been present since the first attempt at penetration. Secondary, pain develops later, often after trauma, infection, or childbirth. Section 4 How is it diagnosed? Diagnosis is delicate and should be done by a gynecologist or pelvic floor therapist who understands this condition. During the exam, we rule out infections, injuries, or anatomical issues. We observe the vaginal muscles response. We ask about sexual and emotional history. Sometimes, we may do a Q-tip test to assess sensitivity. The key is that this should never be rushed or forced. A trusted doctor will prioritize your comfort and work at your pace. Section 5 How Vaginismus is Treated. Yes, vaginismus is completely treatable in most cases. And no, it doesn't always require surgery or medications. Treatment is usually non-invasive and highly effective when done with care. Treatment approach. 1. Education and emotional support. Understanding your condition is the first step. Knowing it's not your fault lifts a huge emotional burden. 2. Pelvic floor physical therapy. A trained therapist helps gently retrain the muscles using gradual desensitization, breathing exercises, and relaxation techniques. 3. Vaginal dilator therapy. These are smooth, medical-grade tools in various sizes that are used progressively to allow the body to accept penetration again, without fear or pain. 4. Cognitive behavioral therapy, CBT. This helps break the link between fear, trauma, and physical pain. You'll learn to take control of your response. 5. Couples therapy. If vaginismus is affecting your relationship, counseling helps partners build trust, improve communication, and remove performance pressure. 6. Medical support. In some cases, topical anesthetics or Botox injections may be used to relax the muscles temporarily, but these are not first-line treatments. Healing takes time, sometimes weeks, sometimes months. But thousands of women have gone from fearful, painful intimacy to enjoying a fulfilling, pain-free relationship. Here are final words from your gynecologist. If you're facing this, you are not broken, and you are not alone. Vaginismus does not define you. And it does not have to steal your joy. You are worthy of a pain-free, loving, intimate life. And if you're someone watching this who suspects their partner or loved one might be silently suffering, share this video with them. You could be the reason they seek healing. Backhand index pointing right. Subscribe to Lifelong Vitality for more honest, expert-backed health topics that no one else talks about. We're here to support, educate, and empower you. In the comments, tell us, what health topic do you wish people talked more about? Your voice matters. Let's keep the conversation going.